Recognizing the early signs of lung cancer is crucial for early detection and effective treatment. Lung cancer is one of the most prevalent and deadliest forms of cancer worldwide, often diagnosed at advanced stages when treatment options are limited. However, by being aware of the early symptoms, individuals at risk can seek medical attention promptly, potentially improving their prognosis.
Lung cancer is now increasing day by day, and it is one of the most common cancer which is causing the morbidity and mortality. So the most common symptoms which the patients come with the lung cancer are cough which is not going despite being on the antibiotics and anti-allergics. Then they may have the blood tinged sputum or the hemopsis, or they may have the hoarseness of voice, or they have the difficulty in speaking because of the involvement of laryngeal nerves, or the patients may have a pleuritic chest pain, that pain which is increased on coughing or deep inspiration. So all these can be the early symptoms or sign when the patients come to us when they have the lung cancer. Despite this, if these patients they have a significant weight loss, or they have a weakness or fatigability throughout the day, and it is not going up despite being on the tablet paracetamol or the antipyretics, then we should have a high clinical index of the suspicions for the diagnosis of lung cancer.
Differentiating the symptoms of lung cancer from those of other respiratory conditions or illnesses can be challenging due to overlapping signs and symptoms. However, understanding the subtle differences is crucial for timely diagnosis and appropriate treatment.
The difference in the symptoms are that if the patient responds to the nebulization of inhaled corticosteroid and beta-2 agonist and antibiotics, like the cough and breathing difficulty, it improves, then we are dealing with the obstructive airway disease. Similarly, if the patients they respond to the antibiotics, then they may be dealing with the pneumonia. But if the patients not respond to any of these antibiotics or anti-allergics or nebulizations, then we may be dealing with the lung cancer, especially the patients who are having an age of more than 50 years of age, or those who are a current smoker or ex-smoker. So we should have a very high clinical index, because the symptoms most of the time they are quite similar, but definitely the hemopsis is the one symptoms which is most commonly seen in the lung cancer, means the blood in the sputum. So patients may have this kind of the symptom very first or in the early stage of the disease.
Detecting lung cancer at early stages is crucial for improving treatment outcomes and survival rates, where screening methods aim to identify the disease in its initial phases, often before symptoms become apparent.
Screening means when the patient does not have the disease and we have to identify the disease at a very early stage. The screening for the lung cancer is by doing the low dose CT scan. So low dose CT scan is most commonly prescribed in those who are more than 50 years of the age, or current smoker, or has left the smoking in last few months or the years. And this low dose CT scan has been recommended based on the randomized controlled trials, and it is well proven, and it is being followed in the Western countries like USA and Europe. In India, we require our own data to follow these guidelines. We also recommend that if the patients they are having current smoking history and the age is more than 55, then we should go with the low dose of the CT scan at least annually.